Welcome to Speak Life with Dr. Amy Chai. Information for your best life. Now, here's Amy Chai.
Hello there. Welcome to Speak Life. I'm Dr. Amy Chai, and welcome to the show. Today, I'm going to talk about something that is important to a lot of my patients, but it's something that I really don't take care of, and that is dental health. You'll notice that the title of my talk is about fixing teeth for people who are short on cash. Well, there's two types of people in my practice who have problems with their dental care, with teeth, like losing teeth or having bad teeth. And those are people who either can't afford the dental care, and also people who have problems with substance addictions. And this causes tooth loss. And I do have a methadone clinic. So a lot of patients that I have both of these problems together. They have financial problems and they also have problems with street drugs or methadone. So today I'm going to talk to you a little bit about what can you do if you have dental problems, but you don't have any money. And I know where you're coming from. When I was growing up, we couldn't afford toothpaste, let alone a trip to the dentist. So I was forced to brush my teeth with baking soda. And I absolutely do not recommend that. It's pretty nasty. But that's what I had to use growing up. So today I'm going to talk about first, what are the problems that happen to my patients when they have teeth falling out? Well, one of the problems that they have is that it becomes very difficult to eat the healthy food that they're supposed to eat. And I'm always talking about how you need to eat more vegetables, more fiber, more whole grain, more natural food that isn't prepared and, what they call like overly processed or highly processed foods. Well, it's hard to eat healthy when you can't chew. The other problem that my patients face is really embarrassment. And this is hard to talk about. For some reason, at the store, they'll sell things like, hillbilly teeth that you can wear that makes you look like you have bad teeth. And I think that's very cruel. But people are afraid to smile. And a lot of my patients have something called social anxiety disorder. And so when they can't smile, they just feel so self-conscious that they really need to get their teeth fixed, but they don't have the cash. And of course, today, a single filling will cost you a few $100s, and a single dental implant can cost a couple of $1,000s. So it's very important to do what you can do to take care of your teeth yourself. Okay, so I'm going to teach you some of the cheap and easy ways to solve some of the problems that are brought on that cause tooth decay. So the first thing I want to talk about is the two evils of tooth decay, and that is acid and sugar. Now, acid is anything that is, sour, like perhaps lemons or actually coffee, soda. Sometimes the carbonated beverages are acidic, orange juice, tomato sauce. We have a lot of Italians around here. Tomato sauce is delicious, but it's also acidic. And when you have that acid on your teeth, what it does is it dissolves the enamel. And the enamel is the part of the tooth that is the outside of the tooth. It makes it easier to get cavities. Okay, so that's the one tooth destroyer. The other tooth destroyer is sugar, and that's any kind of sugar, because what does sugar do? Sugar is the one thing that you can feed bacteria. And when you get bacteria in your mouth, it can form plaque and it can make it so that you're more likely to get tooth decay. So all of us are, all of us have problems with acid and all of us have problems with sugar. But there are also some problems unique to my patients. And those are patients who have problems with drug addiction, methadone treatment, or other medical problems, such as, for example, sleep apnea or the use of multiple medications. And let me explain to you a little bit about why that happens. Okay. A lot of my patients say, well, you know, when I want to look into their mouth, to check the back of their throat, they don't like, no, I can't open my mouth because my teeth are bad. And it's like, it's okay. It's okay. I'm not going to, you know, mock you for not having teeth. But what they all say is, why do I seem to be losing my teeth now that I'm on methadone? And I'll explain a little bit about that. So, medications like methadone and also some other medications like anything that what we call a sympathomimetic, like Adderall or methamphetamine or amphetamine, and a lot of psych drugs as well. They actually make it so your salivary glands don't produce enough saliva. So they give you a dry mouth. Okay. So the dry mouth from these drugs is a very important cause of the tooth loss that you get when you have problems with drug abuse or addiction. Another cause of teeth problems is that certain types of drugs, especially, meth is meth is very famous for this. It causes teeth grinding. So at night, you won't even realize that you'll be just grinding your teeth. And what that can do is that can damage like the gum line, make the gum shrink a little bit, make your teeth even cracked, make them more likely to be damaged and to fall out. So if you have an issue with certain medications, or if you have a problem with certain medical problems, even like diabetes or sleep apnea, these medical conditions cause dry mouth. So, we're going to talk a little bit about the main three issues and how to deal with them to prevent tooth decay and tooth loss when you're on a budget and you can't afford to get those cavities filled or you can't afford to get those dental implants. The best thing to do is prevention. So let's start with the cheapest thing that you can do. What's the cheapest thing? I've got it right here. The cheapest thing that you can do is to get a bottle. Now, a bottle, I got this bottle for free actually. It was like a promotional gift, okay? But most, water bottles, if you can, like, it has a little thing that you can pop up, that you can drink out of, it costs like $5 or $10, right? So it's a very cheap option. Fill it with plain water. Let me hear it again. Fill it with plain water. Okay. So there's a couple things that the water is going to do. You carry it with you all the time, and especially, if you've ever been trying to lose weight or anything, or if you want to be healthy and exercise, you have to stay hydrated. And a lot of us aren't hydrated. But that's not all. A lot of us, and I do too, is like drinking a lot of coffee. Well, like we said, coffee is acidic. Um, and actually, everything that you drink that is either acidic or has sugar in it is very bad for your teeth. So I would definitely say avoid all sugared drinks. I would say avoid all fruit juices. Avoid taking in calories through what you drink, like soda or those like coffee drinks that are kind of very sweet. Um, you know, all of those things can harm your teeth. But I'm not going to tell you to give up coffee because coffee is the fluid of life. So don't give up coffee. But it does have acid on it. How do you get the acid out of the coffee? Well, one of the things that you can do is actually to put a little milk in it, and milk will neutralize some of the acid for you. But I like my coffee black, okay? And I mean, if you like sugar in it, you should get a sugar substitute like stevia. But I like my coffee black. So after drinking coffee, you break out the water and you put some water in your mouth, let it circulate around in your mouth, swallow it, and then just hydrate yourself a little bit with the water. And that's going to wash the acidic coffee out of your mouth. And you're going to do the same thing after any time you have food in your mouth. You're just going to drink some more water. And not only is that going to get the sugar and the acid out of your mouth, but it's also going to help your mouth from becoming too dry. Because as I said, these medications such as methadone and a lot of the psych medications as well cause dry mouth. So this fights dry mouth. So you've been told to drink water, and you really need to drink water. It helps your dental health. It doesn't just help you lose weight. It doesn't just help you exercise more efficiently. It actually helps your teeth. So bring this bottle. It's very cheap. It's very easy, zero effort, and almost $0. So this is step one of cheapness. What is the next cheap step that you can do? Well, obviously, brushing your teeth. Everyone knows, brush your teeth twice a day and use a soft toothbrush. I personally like the Sonic Hair toothbrush. It has that sonic sound waves that helps get the plaque off of your teeth. So it's actually a very good type of toothbrush. It's a pricey toothbrush. So if cost is an issue, you might just want to get a soft bristle brush, but brush your teeth twice a day. And then I want to talk to you a little bit about what you would do after you brush your teeth. Or if you don't brush your teeth, I get it. I get it. You don't always brush your teeth sometimes, right? Don't always do it, but you should. But if you don't, of course, you want to have a fluoride containing mouthwash. And the mouthwash should not have any alcohol in it. No alcohol, okay? Because that'll dry out your mouth more. And as I said, lack of saliva is a big problem that causes your tooth loss. So I'm going to say a fluoridated enamel care, like this one's Crest. And Crest is not paying me to show, they're not showing me this product endorsement, but anything that says alcohol free, you don't want alcohol in your mouthwash. And it has fluoride in it. So what you want to do is take a little bit of it in the cap, swish it around for 30 seconds and spit it out. You don't want to swallow a mouthful of fluoride. You want to spit it out and don't rinse after that. You're done. Okay. So, number one cheap is the water bottle. Number two cheap is a fluoride dental rinse that does not contain alcohol. And there's several different brands. Like I said, I'm not recommending Crest or anything like that. You just find the one that's cheapest. They sell it at the dollar store, they sell it at Walmart. Just get the cheapest one. And as long as it has fluoride in it. Okay, so those are the first couple of steps. The third step here is candy. Now, I don't know if you can see this, but this says Zelly Pop. This is a healthy, clean teeth lollipop, okay? But any type of like a sugar-free, tooth-friendly, like if you go online, one of the online shopping services, I got these off of Amazon. I'm trying not to do product placement here, but I'm just telling you, I did get these off of Amazon. And these are just suckers. And when you have dry mouth from medications, and as I mentioned, there's a lot of medications that do cause dry mouth, and certain conditions also cause dry mouth, such as sleep apnea, and also diabetes can cause dry mouth. You'll want to not only hydrate, but you'll want to create your own saliva flow. And that helps to rinse through your teeth naturally and get the kind that you can just put it in your mouth and sort of suck on it without having any problems with having sugar coating your teeth. Like a lot of the candies or gums might have sugar in them. You have to make sure that it's dental safe, like sugar free. And the best kind of sweetener that you can use for these type of candies or suckers is actually xylitol. It starts with an X, xylitol. And they'll have that in like diabetic candy, like the little lemon drops for diabetic patients, or the hard candies that you can put in your mouth. The other thing you can put in your mouth would be like a dental friendly tooth, like a gum or something you can chew. And this just helps keep the saliva flowing. So we have the hydration, we have the fluoride twice a day, and we have something to get the saliva going. And these things are going to help to counteract the problems that you have with the acid, the sugar, and the lack of saliva. So I don't want to be, a nag, but I kind of am sometimes. um, Smoking also causes dry mouth and can also cause some tooth damage. So, I mean, smoking is very hard to quit. I get that. But, if you can replace a cigarette with a sucker, that's one less cigarette that you're going to smoke that day. So, and I should probably do a show completely about smoking cessation, but that is going to help you to keep your sinuses clean so you don't breathe through your mouth, because that'll dry your mouth out too. And it will save you money, and it will help in all the other ways, like less cancer, less heart disease, and all those things. So if you can give up those little cancer sticks, that will also help your smile. So those three things that I talked about, those are the cheapest things that you can do to keep your teeth healthy, okay? There's also the dietary changes that you can do, which is to avoid the highly processed foods and the acidic foods. And if you do eat them, to be sure to hydrate afterwards. Now, I am going to go on and say a couple of additional things that's going to help you to keep your teeth intact, because an ounce of prevention is really worth a pound of cure. And one of the things that is kind of a pain is actually trying to floss, right? Everyone hates flossing. I shouldn't say that. Should I say that? Am I allowed to say that? I'm just being honest, okay? I hate flossing. This here is, it is $69. It is a Waterpik water flosser. And this, you basically, it just sort of, shoots the water along your gum lines, and it helps to prevent that shrinking up of your gums, like that I said you can get from like grinding your teeth. That's not good for you. But the good thing about this is that it is cordless, and you can actually do this in the shower. So you don't have to have this bulky big thing like on your bathroom sink. You can just put it in the shower and done. So I'm thinking about, all these things together. The first thing, $5 to $10, right? $5 to $10. Okay. This liter bottle of fluoride and alcohol-free rinse was only $8. Cheap, right? These, they're basically cheap as any other hard candy. It's not a lot of money. And then this is $69. So we're talking like not very much money, okay? And the other thing you can do is just start where you are. Start doing one thing at a time, because let's face it, when money's tight, maybe taking care of your teeth isn't the first thing you're thinking about. You might be thinking about taking care of your car, or, making sure the brakes work on your car. You might be thinking about, making sure your bills are paid. So sometimes it can be hard to think about doing the right things. And that's with the diet, the sugared drinks, the highly processed foods. And it's also with, the hygiene, because it takes time and it takes, building the habits. So the first thing I want everybody to do is to, get a water bottle and start using it, especially after acidic foods, coffees, and just avoid having sugary drinks as much as you can. So, so this is kind of the answer to the question that so many of my patients have. And that is why are my teeth falling out? And why does methadone make my teeth fall out? Of course, methadone is liquid, and it'll actually coat your teeth while you're drinking it, and it'll coat the inside of your mouth. And actually, it does dry up your saliva. So you have an extra drying, your mouth is very dry. All you have to do is, after you take your methadone, think about taking a nice swig of water and hydrate yourself a little bit. That's going to help. Every little bit helps. So I hope that this little brief talk about dental hygiene will help prevent tooth loss for you if you don't have the money to go get the dental care that you need, if you don't have a dentist to advise you, because it's so, so, so important for your overall health and your mental health as well, to be able to eat and to not be afraid to smile, not be afraid to look people in the eye because you're embarrassed about your appearance, and or endure pain, or dental infections. It's not fun, and I know I've been there. So I hope that little bit of advice has given you some ideas of how to prevent problems that may come up with dental care. So if you have any questions, put them below, and hopefully I can answer them. And thank you so much for watching Speak Life, and we'll see you next time when we're going to talk about inflammation. And I think that's going to be a really interesting topic as well. So, see you next time.
Tune in next time for Speak Life with Dr. Amy Chai at ctpolitics.tv.